Yes. And with collaboration, we talked about workforce a little bit, but how does virtual care really support those bedside team rather than strain them? Can you just elaborate a little bit more on that?
Yeah, so I think we support it in different ways depending on the service line, right? And I think, if you look at emergency or our ICU product, it's really helping them with those really critically ill patients in that time of need. But I think if you look at our pharmacy services, I think it's a great way to look at it. Many of these areas that we work with maybe lost a pharmacist, right? Or they only have one pharmacist that works in their facility. And so they're a kind of a Monday through Friday person.
Yeah. And
in many of our service lines, we take kind of those hours that people don't always love to work. Right?
Yes.
As someone who's worked a lot of night shifts, right, in their life, I think, we work a lot of nights, a lot of weekends, a lot of holidays. And I think if you think about pharmacy services, they'll even, if their pharmacist needs to take a vacation, they'll just fill in, right? And so otherwise, they would have had to bring in a traveling pharmacist at a really high rate, but we're able to just fill that gap for them. And then they don't have to have that worry. We hear from administrators like, I don't even have to worry about that anymore because I know that if I have a gap, that you'll fill it.
Yeah.
And so, but yeah, nights, weekends, holidays, I think if you look at pain points, we fill them.
That's awesome. So a lot of what we do is invisible because we try to be, just part of the solution or part of their workflow. Can you talk about what physicians don't always see but absolutely rely on when these processes take place?
Yeah, I think that there's several things. We already talked about licensing and credentialing, right? All of that work that's done. But I think part of it is, too, our implementation process, right? So once we partner and have that contract, then we have a whole team that works with your team, right? That hospital's team to bring us to go live.
Yes.
So it is all of the equipment. It's, right? Making sure the connectivity is there, In those early days, man, we were like waiting for wires to be buried, right? Wow. So we don't have that anymore, but we still have to make sure, right, that they have the right technology, the right connectivity for our services. And then it's the tech, right? And then it's getting everybody up and ready on their electronic medical record. It's training our physicians. And then it's continuing to have those quality programs and making sure that we're continuing to look at if they have quality programs that we need to be part of, or even just within, we're constantly looking at how can we be better, how can we make this better, and then how can we quantify it so that we can share that story with our customers.
Yeah, absolutely. So in the world of TV and soap operas, there's lots that are trying to convey from the hospital or the medical setting. So you got Grey's Anatomy, you got, all these other ones, but one of the most recent is The Pit.
Yeah.
And what you see in there is all of these urban facilities and the chaos that's going on within the hospital walls, whether the beds are filled, the hospital hallways are covered with patient beds being filled as well. Is that the typical what we're seeing today when we're talking about, these hospitals are being full to max capacity right now, or the staff are stretched all the way thin? Is it giving a good sense of reality?
Unfortunately, it really is.
Yeah.
We're seeing that, we're putting on our EMRs hallway bed number 1, hallway bed number 2, and so hospitals are full. You can't get patients upstairs. There's boarding of patients, and so they take up rooms, and so you're still, especially in the ER, right? We're not taking appointments. People come when they come, and so you can't help if there's 2 patients that show up or 20 in the same hour, and you still are responsible for all those patients. And I think, one of the things that is kind of neat that they're trying to portray, I think especially on The Pit, is the stress that it causes on our healthcare workers.
Yes.
Right? I think our healthcare workers have gone through a lot. in the last couple of years. I mean, COVID was very stressful for our teams. And then, like we didn't get a break. It just has continued with hallway beds, with, throughput problems.
Yeah.
And I think too, we do see a lot of the worst. And so it does kind of weigh on teams. And so, one of the things I just heard last week from one of our members was, you guys see so much,
yes.
Doesn't that bother you? And I think, of course, I think the answer is of course.
We wouldn't be human.
Right. I think, the day that I take care or pronounce a child deceased, I think is the day I got to hang up my stethoscope. Right. And so I think that one of the things that we offer is walking people through those really difficult times. And so, we don't always get to decide the end result, but we just have to show up and do our best work on every patient that comes in the door and know that, it's not always up to us, what happens in the end. But what we hear from a lot of our partners on the other side was, being able to talk through with you and saying, you did everything that you could have done. There's nothing else I would have done to change this outcome. I've had people tell me, like, that's the first time I've ever slept after a situation like that. Yeah. That I knew that I had done everything that I could. And so one of the things, too, that we bring to the table is, we do stress debriefings on some of these really, really difficult cases and help their teams to kind of talk through it, because what we want is for the people who are going through this and to come back the next day.
Yes.
Right. And I think that's portrayed pretty nicely in some of these shows, right? Is that, people sometimes they don't want to come back. It's hard to sometimes come back, or, sometimes the places that we work are somewhat dangerous, and so we're that second set of eyes and kind of a protection in some way. And,
yes.
And then just offering support. And so I think it makes a difference. And hopefully we're keeping people in the workforce longer and helping them to kind of carry that load.
Yeah.